Absolutely. I'm proud to be a graduate of this program. Some 24 years ago, I came as an intern, and I have stayed on doing my training here, joined the faculty, and I now, for the past 13 years, have had the privilege of being the chairman for the Department of the Family Medicine. So it's been an absolutely wonderful ride, and part of the reason I stayed was because once I got involved in the residency program, I realized how exciting it was, all the cool outcomes that can happen here, the tremendous opportunities to interact with residents, to interact with our special patient population, and it wasn't something that I wanted to give up. So I've stayed on for all these years and been very grateful for the opportunity to do so. Yes, this is interesting. Years ago, one of my other hats that I used to wear was I was the transitional residency program director. And at the time, I had one of my residents that came to me and said, hey, you have such cool patients here, such interesting things that happen. Do you have an actual focused research program at the hospital? And my answer was, no, we don't. And it was thanks to his inspiration that we decided we'd start our own research day. His name is Dr. Lee, and he actually is currently over at UCLA as one of the vice chairs of interventional radiology there. But for that very first year when we did research, he and I got together, and of the 13 submissions, we wrote 10 of them. It has now since gone on to the point where all the residency programs in the institution participate. We average between 65 to 90 different excellent research submissions every year, and a lot of these various projects have gone on to actually change practice both here in the institution and in the community due to the work that the residents have done. So it's a wonderful thing, and I'm just very, very privileged and humbled to be part of it. Well, it's a little mind-boggling to realize that for almost as long as I've been alive, we've had a program here that's been training and generating physicians who are among the most committed, competent, compassionate, and capable physicians to enter into the community.